All right. So when we're speaking of the joint, when we're speaking of the mouth, which is part of the digestive system and the tongue, just talking about the temporomandibular joint, even though this is a joint, it's, talking about the bones, but this is where the mandible connects to the temporal bone. And remember, a fossa um, is a depression in a bone. So where we're talking about, let me get to the picture, is right here. So if you see what I'm pointing at, here's the mandible, and the edge of the mandible, it actually comes up under that arch, which is the zygomatic arch. So the TMJ joint, or temporomandibular joint, is right near where the ear is, right at the very back of our jaw. And the temporomandibular joint allows pretty much for extension and flexion. It pretty much moves up and down. So it extends. If you remember the masseter muscle elevates the mandible while chewing. But the other thing is there is a degree of translation, which is like a circular motion. So not only does the jaw go up and down, but it can go from side to side. Now, how much it does that depends on the species. Now, I don't want to do it now. So, if you ever have TMJ joint problems and it hurts sometimes, like right here, people can get, problems like, especially if you sleep, sometimes people, clench their jaw when they sleep and they're kind of like, and sometimes you can get pain right there. But you can move your jaw back and forth, side to side, and that would be translation. Now, if you have a cow or a horse, yes, and a lot of people suffer. It's kind of like an awful pain that they can get right there. Sometimes people get braces for it. Sometimes, if you, like I said, a lot of people get it because when they sleep, they don't realize that they're like, especially if you're stressed and you go to sleep with a clenched jaw like this, and then you wake up and you're like, ah. So, but if it's a cow or a horse, they have a greater degree of translation due to, I know, and I hate that pain. I hate that feeling, like if you couldn't open your jaw. But there's a video we're going to end up watching of a cow, and you can actually see when they're chewing their cud, it's almost because they're grinding their food. Okay, so when they eat hay, they eat grasses, they actually grind it. It's not like they can just chew up and down. They're actually going to eat better the more they can grind. So again, the degree of translation, the degree of movement is really dependent on their diet. So they are going to have a greater degree of translation than, a carnivore would. Now the pharynx, I've already kind of talked about the pharynx when we talked about that picture of the head, but it is part of the GI and respiratory tract. But if you remember, I said pharynx, food first. So it does contain respiratory and digestive structures, but when an animal swallows, so they're going to grab with their teeth, tongue is going to, bring the food in, it moves through the pharynx, and then it's going to be chewed, and then it'll move, the epiglottis will close to protect the trachea, and the food will go into the esophagus. The other thing that is in the back of the pharynx that I didn't talk about in the last lecture is the eustachian tubes, which is the tube that connects the inner ear to the back of the pharynx. Now, the eustachian tube helps regulate the pressure in the ears. So like in people, if you fly, if you've ever flown in an airplane, sometimes they're like, you need to chew gum or yawn. Well, what you're doing when you chew gum or you yawn to pop your ears, or if you ever drive through mountains and you kind of go up and come out of the mountains and you feel like your ear is stuffy, the change in atmospheric pressure, what you can do when you yawn is you're moving the back of your pharynx and you're pulling that tube, and you're trying to like equalize the pressure in your ears. So chewing gum or yawning, if you're going through like mountains or flying on a plane, it helps regulate the pressure. The other thing that's in the back of the throat or the back of the pharynx is the tonsils. Now, animals have tonsils. When we intubate for surgery, a lot of times you look back there and you see these two kind of raised red structures. They're not like round and like sticking in the airway. Sometimes they can be swollen and irritated. In people, People tend to suffer from tonsillitis. I had my tonsils removed when I was like 5 or 6 years old because I was constantly getting like sore throat. So I had tonsils removed. We don't typically do tonsillectomies in animals, but they do have tonsils back there. They're part of the immune system. We can live without them, don't need them, but that's where they are also found, in the pharynx. Now, after we get to the pharynx, it connects to the esophagus. And the esophagus is a muscular tube, and it's going to it's the connection pharynx to the stomach. Now, it is a series of folds. It's mucosa, so it has a mucosal lining, and it is a little bit folded. It does have some kind of ridges because it can stretch. Anything that can stretch and constrict can kind of have a folded appearance. Like there's folds to the stomach, there's folds to the bladder, there are some folds. But the big thing is to remember there are 2 layers of muscle, tunica muscularis, but is basically the circular and longitudinal muscles. If you remember that cross section where I talked about the layers of the basic GI tract, the circular muscles, when they constrict, they compress in the middle, and they can break things up by compressing. So if a big chunk of food is moved in, the esophagus can kind of squeeze and break it in half because it's trying to, first of all, take things to the stomach, but sometimes it has to be broken up. But the longitudinal fibers, think longitudinal or long, when they constrict, they tend to move. So the circulars are up and down, and the longitudinal move forward. But that's how it creates the muscles, the muscular movement. So the esophagus is a muscular tube. It's lined with mucosa. And then we have the steps to a meal. So basically, I do want you to know these terms. Prehension is grabbing. So when an animal goes in the food bowl, there's a prehension. They grab the food. Then they start to chew it, which is mastication, and hence the masseter muscle. So they chew the food. While they're chewing, they're going to have salivary secretions. Now, I already told you salivary secretions can happen 2 different times. Most of the time, it's when food hits the mouth. When they chew, saliva is secreted into the oral cavity. But they can also have conditioned responses where they're already they hear their can opener and they start salivating because they know can opener means I'm eating dinner. And that can start. The last stage is swallowing, which is deglutition. And that's when the food is moved from the pharyngeal stage to the esophageal stage. Now, this is voluntary, okay? I mean, some animals, I'm sure we all have pets that just inhale their food. Some animals chew more. Sometimes it depends on what you're feeding them. Some food they don't have to chew, and some is like big bites of kibble. So how much they're going to swallow whenever they detect that the food is ready to be swallowed. Once it moves into the esophagus, now moving into the esophagus is voluntary. Once it hits the esophagus, it becomes involuntary. Like the animal cannot control its esophagus. Once it moves, that's going to be dictated by the GI, the nervous system, and the sensory system of the GI tract. Now, peristalsis is very important. It's a pattern of muscle contraction. It's wave-like muscle contraction. Think of it this way. You look at what I'm doing on the screen. And what it's going to do is it's going to contract in the middle. It's also going to contract long ways, and it's going to move the bolus of food down the esophagus. Now, when food is moved into the esophagus, we call it a bolus. Now, sometimes we talk about a bolus of, like if I bolus an animal a medication, I basically squirt a bunch of medicine in the IV, quickly. But a bolus is also a name for when food is entering the esophagus. And that peristalsis is going to continue. Now, the peristalsis is a continuous wave-like motion that should be continuous, and it's going to continue into the intestine. One thing that's important later is The intestines should always be moving. There should always be a degree of peristalsis. When an animal is in parasympathetic stimulation, that's when GI activity is increased. So, like a lot of times, if you guys work somewhere or if you ever get to help with like an abdominal surgery, one thing the doctor looks at is we look in the intestine, and there should be, it's kind of cool. Like you get to see the intestines moving like a wave. And that's good. It shows that there is movement to the intestines and there is peristalsis. There's something that we worry about, especially in like cows and horses and rabbits, called ileus. And ileus is when the intestine is still, when it is not moving. Now, animals that are dependent on their GI tract, dependent on their intestine, cows, horses, rabbits, if they have ileus and the intestine is not moving, they can get very, very sick. And we can give them drugs to kind of hopefully kick in peristaltic movement, but peristalsis is this continuous wave-like motion that should be good. Now let me show, let's see. Let me see if I can get it to pull up. Okay. Now, I only bring, I like to bring up conditions that we sometimes see that becomes important later down the road. Okay, when we look at an x-ray, normally, if you see where I'm pointing on this x-ray, normally the diameter, how wide, it's just supposed to be like a tube. If you look at this esophagus, now the esophagus, this is the thoracic cavity. The esophagus goes through the thorax, moves through the diaphragm, and this is the stomach. This is showing on the x-ray. What they've done here is what's called a barium study. And what we can add, it's contrast. It's kind of like this milky white, chalky liquid. We have the animal eat it, and then we can take x-rays at certain times, and we can watch, and it highlights or lights up the GI tract. And especially if we're looking for potentially a foreign body or any abnormality to the GI tract, we can use barium. And so this food is lit up, and you can see this esophagus is pretty wide. This is something called the mega esophagus. Now, this is huge. This is all esophagus, which is way, way, way too much. So now this is a really good picture. This is a really good x-ray. So here's the esophagus, dog swallowed the barium, and then we've got this big balloon. And then all of a sudden, the middle of this esophagus gets constricted. So it looks like this animal probably eats, but what do you think happens after this animal eats and it hits this constricted part of the esophagus? What about vomiting or regurgitation? It gets stuck, and then if it can't go this way, it's going to come this way. A lot of times what happens in mega esophagus, what happens is that the esophagus is dilated and it loses that contractibility. So sometimes these dogs, they eat, they get up, and when they bend down, food can come out. And they're not vomiting. If you watch them, they're not like constricting. It's just that food was sitting there, and gravity, when they bend down, it comes right back up. So these are all abnormally dilated esophaguses. Now, what can happen? This can be genetic. Sometimes happens in German Shepherds. It can be due to an injury. Like, say, for example, if I go back to that one, I don't know where it was constricted. Say the dog ate something hot or caustic, and it caused an injury to the esophagus, and sometimes the esophagus scars down. And what happens is the scar tissue constricts the esophagus. Well, then what happens, the area proximal to that, or in front, actually becomes dilated because it's called an esophageal stricture. It strictures down. So sometimes it can follow an injury. Sometimes it's genetic. Well, actually, no. I mean, it is going through the esophagus, but it doesn't usually affect the movement. That's a good question. It doesn't usually affect the movement. Most of the movement in the esophagus is dictated by the muscular layer or peristalsis. So all of esophageal movement is it's dependent on the muscles within that tube, if that makes sense. So it shouldn't affect, like thoracic pressure does affect blood flow, the vessels going through to and away the heart, but it doesn't typically affect the pressure of our esophagus because the muscle is enough to counteract any thoracic pressure issues. Now what can happen is, and you guys have probably, I don't know if you guys have ever, like, look at these pictures. Like, so they're like, here's, you know, shepherd. So this is called a Bailey chair. And we actually have one somewhere in the kennel. It's probably in a storage closet. So what these dogs do is they eat. Maybe I can show you the video. Let me see if it'll. Let's see if I can get this to play. Ready? So when megaesophagus happens, there's not a lot of, if it's genetic, if it's due to a stricture, sometimes the doctor will go in and they'll try to balloon the esophagus, the area that's narrow, they can try to blow it up and open it up. But the problem is the muscle ahead of that, that's stretched out, sometimes it doesn't come back to normal. So that dog, that muscle gets stretched, it loses its ability for peristalsis. So these dogs, they can live, but they need help eating. And what they do is they have to be fed elevated. Now, you can put their food bowl on a counter and they have to put their feet up, and they have to have a blended diet. It usually has to be like canned food put in a blender. That's easier to get the food to pass. But if a dog is going to do this long term, you can train them to go in this chair. So you can see, let me go back. Okay. Ready? Ready, check. Ready, check. Tail down. Tail down. Tail down. So they're fed in this chair. So the gravity will allow the food to move into the esophagus. And then usually they have to sit in there a little bit after they eat to let it like continue to go down. You don't want to let them out right away. You kind of want to let that gravity and let it move. And usually these dogs eat very fast and very quick. But yeah, you can train them fairly easily to go in this chair, this Bailey chair. People sell them online. They sell like the plans to make them. You'd have to watch their teeth, Emily, you know, for potential, like, because they aren't eating hard food. I mean, that's a good point. Yeah, they're not, because most of these guys, a liquid diet, not liquid, but like, you know, a canned food, and usually it's, you know, we kind of blenderize it or something. So kind of just letting Bailey hang out in the chair. Oops. Let's see. So there's different articles here on megaesophagus, but it's definitely, oops. Oh, I think I closed my PowerPoint. Oh, there it is. So the big thing to understand with parents, so first of all, it's a big commitment for the owner because feeding has to be done a certain way. You always have to watch them anytime, they're going to drink or potentially eat. And if it can come out passively, they have the potential to re-inhale it. So we have to worry about aspiration. We have to worry, make sure they're eating okay. Like Emily said, you watch their teeth. But I'm really worried about potentially aspirating, and also making sure they get adequate nutrition. So you have to, but again, this can be maintained as long as you have an owner that knows there are some special instructions. It is a manageable disorder because, like I said, unfortunately, a lot of times it's a lifelong condition. It's not usually going to resolve. And so they just have to be willing to kind of make these adjustments. So if there are any questions about that, just pop in. And now this picture is, so we're moving. And that's a good question, Rachel. A lot of times, rather than, some people, a lot of adult dogs get fed once a day, like one big meal at night. Sometimes people do it twice a day. It is better to do small, frequent meals. Now, it is difficult for someone to feed 3 to 4 times a day unless somebody's home all the time. So probably twice a day is going to be definitely better. You want to try to do smaller, frequent meals is going to be easier for them. Okay, so within the abdominal cavity, if you guys now see where now the esophagus is moving into the abdomen. So if you remember about the abdominal cavity as like a space, there is a lining. So remember I talked about the lining of the wallpaper, and the peritoneum is the lining in the abdomen, and it is a serous membrane. If you remember, a serous membrane secretes a small amount of watery fluid. So there is a layer of fluid in the abdomen, and it allows, everything to move without getting stuck to one another. The two sides, you have a visceral and a parietal, is your visceral peritoneum is like the organ side, and your parietal is what holds on to the wall. Now, there are 2 layers to the peritoneum, or extensions of the peritoneum. There is the mesentery and the omentum. And let me just explain the difference. Well, and also this is kind of a neat picture because it talks about the layer. This is the mesentery. The mesentery is the lining. It connects to the dorsal body wall, and it extends to all of the intestine. So the mesentery is the connection to the intestine. This is showing you the layers of the intestine. So you've got mucosa, the muscularis, and the serosa, which is on the outside. If you remember, the serosa is the outside of the intestine. The serosa is going to attach to the mesentery. Now, there is also something called the omentum. We get to see this when we do dissection, because when you first open the abdomen, when you cut open the abdomen and you look inside, you're going to see this thing. It kind of looks like a net. It looks like a big fishing net. It kind of covers all of the organs. And at first, sometimes people during dissection, they're like, I don't see anything. And I come over and I take this whole omentum out. And then they're like, there's the stomach, there's the intestine, there's the spleen. Then you can see everything. This is kind of like a covering. It is connective tissue, and it connects the peritoneum to the stomach and the body wall. So if we look in this picture, on right here, does anybody remember what that bone is right there? That's the very end of the sternum. Does anybody remember what that process is? Yep, that's the xiphoid process. So yep, so that's the end of the sternum. Now, right under this rib right here would be the diaphragm. So it's not in this picture, but the diaphragm, if I went above this picture, that would be the thorax. So this is the abdomen. And the liver and the stomach are kind of up under the ribs. But then at the end of the stomach, you see this connective tissue, and this is the omentum. So it connects the stomach, helps to connect it to the body wall, And it does have a connection to the spleen. This is the spleen right here, this kind of maroon. Now, this is kind of an advanced little tip. When a dog has what's called a GDV, it's called a gastric dilatation volvulus or bloat. It's a surgical emergency. It's very scary. What happens in dogs is dilatation volvulus is the stomach flips. And what happens is it begins to swell. And a lot of times what happens during a GDV is sometimes the spleen gets trapped because the spleen and the stomach and that omentum are all kind of connected. So if a stomach flips, sometimes we get what's called the splenic torsion too, because the spleen kind of gets trapped with all this stuff when the stomach flips on itself. So because of where everything is located, you know, there's a lot of times we've done a GDV and we've taken out the spleen too, because the spleen was damaged when the stomach flipped and causes a lot of problems. So, but basically it's connective tissue. Here's the duodenum. This is the rectum. There's the bladder right there. So this is just a covering. And it, like I said, it's a link for the stomach to be connected to the body wall. Let me try to show you, and this would be, I think it'll make more sense if I can show you. Okay, now this is obviously like a dissection picture. So this has been taken out. This is the stomach right here that I'm pointing at. Hopefully you guys can see this okay. See this picture okay. But here's the stomach. This is the spleen. And then you can see where it's connected. And then this is all omentum. And this part would be connected to the body wall. Obviously, this has all been removed from the body. So this would be connected to the peritoneum, which lines the abdominal cavity. Now, here's kind of a anatomic type picture, but this is like the stomach, the duodenum. Here we've got that, and then we've got this omentum. That's not as great of a picture. Now, this is an interesting picture. This is the mesentery. So what you're looking at in this picture, this is small intestine. This is all the intestine. And then do you see how this is kind of shiny? It's actually like, it looks like cellophane, like it's see-through. But on the interior part of the intestine, you see these blood vessels, and then some of that yellow is fat. And then in between, you have this clear tissue. That's the mesentery. So you can see right here, it's showing you this is the mesentery. So the omentum is on the outside, kind of covering. The mesentery goes in between. Here's a picture of them showing the omentum. Here's someone holding up the omentum. So I say it like kind of looks like a net. Now that omentum, this is a dissection, obviously, and that's kind of all squished together. I'm trying to find another helpful picture. Okay, so this is also a good drawing. So here's intestine, here's the mesenteric blood vessels that come through, and then this mesentery is see-through. So mesentery is in between the intestines, and then you have the omentum covers, this is actually a human picture, but there's the stomach, duodenum, that's all mesentery. Okay. So let me go back to this. Okay, so now we're going to move on to the stomach. And basically so the stomach has some jobs. Obviously, it's a storage container. I mean, when we eat food, it moves to our stomach. So it does store the ingested food. Once the food goes into the stomach, they do have mechanical and chemical breakdown of food. I do want you guys to know which parts of the digestive system are mechanical, which ones are chemical, or which ones are both. So for example, the stomach is mechanical because when your stomach contracts, it breaks up food. It also is chemical because it secretes stomach acid. Now your esophagus is only mechanical because the esophagus isn't really secreting digestive substances. It's really just a muscular tube. So it's moving the food. Your mouth is chemical and mechanical because you have saliva, but you also have chewing. So for each part, I kind of talk about the chemical job and the mechanical job. The stomach also does produce a factor that allows for B12 to be absorbed in the intestine. So it's kind of like a prefactor, and you'll hear me say this a lot. It's like this factor is secreted, and then when the food moves to the small intestine, it'll initiate that, allow for that B12 to be absorbed. Now, when food is in the stomach and it goes to the intestine, it's turned into something called chyme. It's not feces yet. Okay, so it goes from food in the mouth to a bolus in the esophagus. When it's in the stomach, it goes in as a bolus, but it leaves as chyme. And then by the time it gets to the colon, it becomes feces. So that's kind of the process of, I was a hamburger, now I'm feces, but it changes based on what part of the digestive tract it is in. Now, very important, and I think you did, maybe this is review from nutrition, but we talk about animals as monogastric or a ruminant. Now, the monogastric species mono means one, you have one stomach, monogastric. Dogs, cats, horses, people are monogastric species. Now, what's interesting here is, horses are monogastric. They eat basically what a cow eats, except they digest it differently, which I'll get to. Now, the ruminants have a complex stomach, and it has a 4-chamber stomach. Some people they say they have 4 stomachs, the number 4. Well, it's really one structure with 4 chambers, and the different chambers have different jobs, but that would be your cows, your goats, and your sheep. Sheep are ruminants. But I'm going to start off by talking about the monogastric stomach. And it does have a C shape to it, technically. And it's important, it's right behind the diaphragm. Now, if you guys remember, I showed you on that picture, the diaphragm kind of bows into the thorax. And it kind of comes under about the 10th rib. So technically, sometimes, I've said this before, people that have stomach issues sometimes get confused with chest pain. Like they get freaked out, they go to the ER, and you should always get checked out if you're freaking out. But I mean, if you think sometimes it's a stabbing pain, sometimes it's the stomach and it feels like it's coming from the chest because the stomach is right up under the diaphragm, which is right up under our thorax. And that's the same place in animals. Now that esophagus went through the thorax, it's sealed off, but it does pass through the diaphragm and it goes into the stomach. It has glandular component, meaning the stomach has glands in the lining, and anything, remember, that is a gland is secreting something. So the glandular stomach secretes some of the, like the stomach acid and the enzymes that we need to digest a meal. The 3 main parts is the cardia, the fundus, and the body. Now, here's the opening to the esophagus. The upper part of the stomach is called the cardia. That's the opening to the stomach. And the way I remember cardia is it's closer to the heart. In my brain, I always have to have these weird tips, like if I was in school, how would I have remembered that? Well, the cardia comes first. It's the opening to the stomach. And then you're going to have the body, which is this main component. You have a fundus up here at the top, which I'm going to talk about. It acts like a storage compartment. And then you have the end of the stomach, which is the pylorus. Now, the pylorus is going to have different parts. The pyloric antrum is like this chamber right before the food that's going to leave as chyme. Right when the chyme moves to the intestine, it has to go through the pylorus. So pyloric antrum mean it comes before. The pylorus is this neck right here. So this pylorus is a narrowing, and this part of the stomach is thick because it has a more muscular component. Like during dissection, I come around and I look at your stomachs and I said, tell me where the pylorus is. And based on feeling the stomach, you should be able to tell me, because the pylorus is where the stomach gets narrow and thickened because of the muscle. And then there's a little hole here with a circular muscle called the pyloric sphincter. And it's a muscle, and that's what opens and allows things to move from the stomach into the duodenum, okay? Now, a common thing that happens, and I've got a 9-month-old boxer that's eating everything under the sun. A common place that foreign bodies can get stuck, like if a dog swallows a ball, a corn cob, is sometimes it gets stuck in this pylorus because the pylorus is narrow. It's a sphincter. And sometimes something starts to squeak out, but it can't quite fit through. So this is a common area. Now, sometimes dogs get a lot of foreign bodies in intestines where it makes its way through this little bend, and then stuff can move into, and then it can get stuck in the intestine. So it doesn't always get stuck here, but we had a German Shepherd come in, and the dog was projectile vomiting. It would eat and drink and get all excited, and then the owner's like 10 minutes later, the dog is puking, and she's like, not just throwing up, it's like, and when the dog came in, it did it in front of us, and I was like, whoa. And when we took an x-ray, we saw something, and a dog had swallowed a ball, and the ball was stuck. So anytime the dog ate and drank, it went in, and then all of a sudden it was like, not going. If it can't go one way, it's going to go the other way. Okay. And this is just a tip. I mean, my dog, AJ just got in the trash, and it was like 4 days ago now. Caught him eating some stuff out of the bathroom trash. I didn't know how much he actually got, but when he vomited that evening, I was like, okay, you vomited, you ate trash, I took things out of your mouth, and now I was worried about potentially a blockage or something, but he was defecating that night. So I'm like, okay, you're eating, you did vomit, but something is making it through to turn into feces. And then that next morning he vomited. And I was like, it's just rare for him to vomit. And it was like 5 minutes after he ate. He vomited, and it was just food. It wasn't any trash. So then I was like, And then after he did that, later I looked at the feces, and I could see the plastic and the paper and the things that he ate. So it did make it out, thankfully. A friend of mine who's a vet, and I was messaging him, he's like, yeah, he probably just has some gastritis. I fed him chicken and rice the night, that after he was vomiting twice. So knock on wood, we seem to be eating and pooping normal. But if people want to know, does my dog have something stuck or a foreign body, we have to kind of go, when are they vomiting? What did they get into? Can they produce a bowel movement? If something is truly stuck somewhere within the stomach and small intestine, things don't make it out the other end. And then we get vomiting because things can't go that way, they're going to go the other way. So that's kind of our approach to potential foreign bodies. I'm going to come back to some of those parts, but I do want to show you the inside of the stomach has something called rugae, which are actually kind of folds. think rugae ridges. It kind of looks like ridges because the stomach is a hollow organ. And I think I told you guys this before. Sometimes you'll take an x-ray of a dog, and it's a really good x-ray, and the stomach, when it's empty, and it constricts because it's a smooth muscle, it constricts in the middle. And sometimes you'll see like it looks like lines or squiggles. Sometimes it shows up, and it's when the stomach constricts and those rugae constrict that sometimes it'll look like a ball of wrinkles almost. Now, when the animal eats, and then what happens is it increases the surface area. What that does is those folds will stretch out and expand, and that just allows for that meal to become digested. So it increases our surface area for absorption. Now, again, most of your digestion is going to occur in the small intestine, but there is some absorption, obviously digestion in the stomach. If we stretch out the stomach, now if we look at the stomach layer, now this is obviously blown up because, within the layer of the stomach, which is muscle and connective tissue on the outside, you do have these gastric pits. And these actually are where you find the glands. Remember I said the stomach is glandular, meaning it possesses glands in its lining. And what they do is you've got a mucous neck cell. So if you look at this picture up close, it's lined with those cells, and they secrete their substance into the lumen. And so the mucus, there's a mucus layer to the stomach, is produced by the mucous neck cell. And then there's chief cells and parietal cells. And then there's endocrine cells. All these different cells make up these glands, these gastric pits, and they are going to secrete something. Now, obviously, a mucus cell is going to secrete mucus, and that's what creates the mucus layer of the stomach. But let me talk about the chief cells. The chief cells actually secrete something called pepsin. And pepsin is a proteolytic, oh, that's funny, Rachel, I just saw your note. Pepsin is a proteolytic enzyme. What do you think proteolytic means? If lytic means to break something down, what is prot short for? Protein. So if pepsin is a proteolytic enzyme, it is responsible for breaking down the protein in what the animal has eaten. Now, you guys know I'm weird and I say weird stuff. So I tell myself I like a Pepsi when I'm eating my steak that's full of protein. Pepsin, protein, Pepsi, steak, protein. I don't know. If that helps you remember it, fantastic. But the animal does need pepsin to be able to digest proteins. Now, what you're going to find in the digestive system is a lot of things are inactive in the cell, and they're activated once they're secreted into the stomach. So what happens is the chief cells, let me go back. Do you remember these chief cells right here? Okay. The chief cells actually secrete something called pepsinogen. When pepsinogen is secreted into the stomach, it hits the HCl, or the hydrochloric acid. HCl is hydrochloric acid. When pepsinogen is released into the stomach from the chief cell, pepsinogen is changed into its active form, which is pepsin. So hydrochloric acid actually has to activate pepsin. So pepsin is not what is secreted. Pepsinogen is going to be activated into pepsin. Now, if you look at the word, and this sometimes helps me remember things like this, when you see something like gen, pepsinogen, trypsinogen, there's different words that look like this word. It means they're being secreted, and genesis is creation of. Pepsinogen is going to generate pepsin. if that helps you. So a lot of things that are secreted inactive have this gen on the end of it, and then it's being activated by something else. So pepsinogen is secreted, it hits that acidic environment, and then it's activated into pepsin. And pepsin is what is going to digest the protein component of their meal. So pepsin is essential. But again, pepsinogen can't do anything until it's changed or generated into pepsin. So that's just one of the things and obviously hydrochloric acid is secreted into the stomach. I'm probably jumping ahead on things, but the pH of the monogastric stomach it can be as low as 2.0. Now remember, I said 7.4 is base. Anything below 7.4 is acidic. The stomach can get all the way to 2.0. So, I mean, that's pretty acidic environment. I'll come back to that. But now I've already kind of talked about this, but the pyloric gland, which is here at the end, it's the last glandular portion, and it has the parts. It has an antrum, a canal, which is down here, and then the actual pylorus. Now, the pylorus is what opens into the duodenum. The duodenum is the first, I will say this 500 times during this lecture probably. Don't count me, not exactly. The pylorus opens up into the duodenum. The duodenum is the first part of the small intestine. You will need to know the order of the small intestines, but the duodenum is what connects to the pylorus. Now, at this area right here, in the pylorus, there are cells. They have mucus secreting cells. Now that will help secrete mucus so that the chyme can get mucus and move into the duodenum. There's also G cells, which secrete gastrin. And gastrin is going to be another hormone that is essential for digestion. So those cells that are actually found here are going to kind of have their effect after the fact. So it's going to be secreted at the pylorus and kind of used within, and I'll kind of talk about how that happens. Okay, so stomach secretions, what regulates the secretions? If you remember, now acetylcholine, I said, is the primary neurotransmitter for muscular contraction, but I said it's also a parasympathetic neurotransmitter. So now remember, parasympathetic activity increases, or GI activity increases during parasympathetic or rest and relax. So acetylcholine is going to be released. Gastrin is going to be released because first of all, you have food in the stomach, okay? Acetylcholine is going to recognize that there's food in there. And then histamine can be secreted into the gastric mucosa. So all three of these things, because the glandular cells or the stomach detected food, acetylcholine is released, gastrin, and histamine. So all three of those chemicals are going to be released. Now, I've already explained there's a cephalic phase and a gastric phase. So the cephalic, anything cephalic is head or brain. This activates the enteric nervous system, which is your stomach and intestine, basically. That is just, hear the can opener, hear the crinkle of the bag, mom's going in the pantry. And what happens is, once this is stimulated because they heard something, that acetylcholine is going to be released and it binds to receptors in the stomach. And then what happens is the parietal cells release hydrogen and chloride ions or hydrochloric acid. The chief cells create the pepsinogen, and then the G cells secrete gastrin. All three of those things are released, and then gastrin is going to travel to the parietal cells, so they release histamine. So we've got acetylcholine, we've got gastrin, we've got pepsinogen, and all of this is going to be released. Acetylcholine will also release histamine. And histamine being released will increase acid production. Now, I know this said a lot. Basically, just anticipating a meal triggers secretion of hydrochloric acid, gastrin, pepsinogen, and histamine. And all what that does is it starts our digestive enzymes being secreted, and it starts the production of hydrochloric acid. Now, if you guys have heard of histamine before, histamine is usually what's released in our body when we're allergic to something, you know. So if you get a bee sting and you get a release of histamine, you can get redness in the area. It causes kind of like allergic reactions. Sometimes if an animal experiences like anaphylactic shock or a massive release of histamine, like people that are allergic to like a peanut or a bee sting, where we're talking like EpiPen level allergic reaction, sometimes what happens is you get this like you can get a lot of stomach upset. The reason being is that increase in histamine causes an increase in stomach acid too. So sometimes we'll give animals that have gone through that. Obviously, we give them Benadryl for the reaction, sometimes a steroid, but sometimes dogs with mast cell tumors and mast cell tumor disease releases histamine. Sometimes we'll put those animals on antihistamines. Part of it's to control histamine release, but part of it is to decrease stomach acid. So there's like a connection to stomach acid and histamine. It's just kind of a, hey, interesting little thing. Now, that's just anticipation of a meal. A majority of this is going to happen when the gastric phase, that's when the food does actually hit the stomach. As soon as food goes into the stomach is going to start stretching to accommodate. And then when it starts to stretch, we've got peptides that are going to begin to be formed. We've got the enteric reflexes that's starting the movement of the stomach. Vagal reflexes come from the brain. And all of that stretching of the stomach, acetylcholine is going to be released, and you're going to get histamine and gastrin, and that's going to increase hydrochloric acid production. So basically, it's very similar what happens when food hits the stomach, also when a meal is anticipated. So it's basically kind of explaining the same process. And then here, I do want you to know this value for the test. The pH of the stomach can be as low as 2.0, and that's extremely acidic. But again, that's the normal pH of the monogastric stomach. Okay, I want to stop there and ask you, well, oh, oops, let me try this again.